Probably the most common surgery that I perform at Texas Sports Medicine is arthroscopic surgery of the knee. And the arthroscope is nothing more than a camera. We put it in the knee and we look. You look at the top, bottom, right, left, inside, and outside. Well, why do we do scopes? Why do we need arthroscopic surgery? Because of cartilage. There's a difference between ligaments, the medial collateral, lateral collateral, ACL, and cartilage. Cartilage, think of cartilage as a spacer. Think of cartilage as a cushion. There are two kinds of cartilage in the knee. This is the knee. This is the femur. This is the tibia. In between the two bones is a pad called the meniscus pad. You've got one on the big toe side. You've got one on the little toe side. Medial meniscus, lateral meniscus. But there's another kind of cartilage in the knee, and that's the cartilage that covers the end of the bone. If you've seen a drumstick or carved up a turkey, you've seen on the end of the bone there's a white layer of shiny gristle. That's cartilage. When that cartilage wears out and the bone is exposed, that's arthritis. You often hear old people talk about bone on bone. That's what we're talking about. We're talking about that layer of cartilage going away. Sometimes we do scopes for injury to that cartilage, especially in a young person. Sometimes an athlete will get a helmet on the side of the knee, knock off a piece of that cartilage. We got to go in and fish it out. The scope is the best option. But also people get meniscus tears. A meniscus tear does not heal. So if it's symptomatic, if it's causing pain, we go in there with the scope, trim out the torn piece of the meniscus. Back in the old days, and when I say old days, I'm talking about maybe 30, 40 years ago, we didn't know what the meniscus was for. We thought it was like an appendix. Hey, he's got a meniscus tear. Let's take the whole thing out. Well, guess what? Those people ended up having arthritis way sooner than normal. So we realized that the meniscus is there for a cushioning effect. You want to save it. So when we do arthroscopic surgery for a meniscus tear nowadays, you only take out the part that's torn. You leave as much normal meniscus as possible. That way, it will prevent the other cartilage from wearing out, leading to arthritis when you're 40.